you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-877-5752.
No, not 877.
870. Oh, I'm so sorry.
I'm going to repeat it here, Nita. 866-870-5752. And I'll repeat it. It's 866-870-5752. Please call us live right now so we can answer your questions about how to heal your musculoskeletal pain without a surgery. And if you've had long-term pain or new pain, it doesn't matter. I think I can help using platelets or stem cells from your body. And very simple procedures. Basically, you walk in the office, you get injections, and then you walk out. There's none of this stuff about having surgery side effects, which I see all the time, which can be horrific. And I had a surgery on my shoulder back in '94 while I was in medical school, and I had loss of use of that arm for about 4 years after the surgery. And I then had a lecture at UCLA where I was in my residency, and a doctor got up and said, I heal 80 to 90% of my patients with regenerative medicine. And I was the only one out of like 24 of us who was excited about that. And I went to his office and I watched how this was done. I talked to the patients and they said, this guy is God. And he's healed me so many times. So I learned how to do it, and I first injected my wrist back then, and it healed up, and then I did my shoulder, and it healed up, and that was the shoulder that had the failed surgery. And the shoulder one was really amazing because I did it in the evening, and by the next morning, my shoulder was completely pain-free with full range of motion that was lacking. And as I talked before the break, this isn't going to work on everyone, and it's not a magical cure. It just makes sense to stimulate the body to regrow tissue and rejuvenate itself, and that's what regenerative medicine of platelets, which is called PRP, platelet-rich plasma, or stem cells, is all about. It's a natural way of healing, and you don't have to put knives or scalpels inside the body and cut open tissue. Okay, it's not going to work for everybody. It's not going to work for everything, but it certainly works quite a bit when I choose the patient wisely. That means not doing it on people where I think it's not going to work. So give us a call right now, 866-870-5752. I would love to talk to you. And if you catch this later and you want to call later, just call the office. You actually call them now, too. There are people by the phones. The office number is 800-300-9300. That's 800-300-9300. If you give us a call right now at the studio or at the office, I will send you a book postage free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple hundred pages long. It's got all the science of how regenerative medicine works and why surgery is no longer the best answer in many, many cases. There are times when surgery is needed, and I do love surgeons. They do tough work, but I don't like all the surgeries that are being done that don't need to be done. This can also be done on the face. I'm showing a picture of my wife doing the vampire facelift on one of our employees, and it's using the same cells but on the face to regrow the collagen in the face. So it can also be done on the top of the head for people that are whose hair is thinning. Here's a picture of that in the book. and it revitalizes the follicles in the hair and revascularizes it to bring more circulation to the scalp and grow back hair. It's not going to grow back a totally bald head, so don't come in if that's your issue. But if you're losing hair, yes, it's a great thing. Oh, here's a picture in the book that I love. This is Nick Lamb. He's a world surfing legend. He won the contest at Mavericks, which is like 60 feet waves. And I just actually spoke to him the other day. He's still doing pretty good. I worked on his knee. Here's an Olympic athlete, picture of that. And you can also actually go to Yelp, YELP.com, and put my name in there, Marc Darrow, MarcDarrow, MD. And you'll see hundreds of reviews of people that have had this done that had good luck. There's a few bad reviews because there's always some people that are always a little grumpy or didn't get what their expectations told them they should have. But it's an interesting read. And I often tell my patients to go read the Yelp reviews before they get a treatment to see if it's good for them. So, Nita, should I go to another question?
Sure.
Okay. This one starts out by saying, I tried PRP some time ago and it didn't work. So this is interesting. Let's see why. By the way, PRP is a simple process of drawing your blood from your arm, spinning it in a centrifuge, taking out the red cells and injecting the plasma with the platelets. So it's called platelet-rich plasma. This person says, I tried PRP some time ago. It didn't work. What do you think I should do now? Unfortunately, let's see if this patient responded. No, I wrote back, but they didn't respond yet. Unfortunately, it doesn't have information about which body part it is. I already mentioned some of the reasons that PRP and stem cells will not work. And one of them is not enough treatments. And this person said, I tried it once. It's not a magical cure. All it does is regrow the tissue around the injury or the arthritis to rejuvenate the area. There are times I've injected myself that I've healed literally overnight, and there's times that have been more stubborn where I've had to inject several times over a period of a month or two to heal. So that's how it works. It's something that is not magical. It just makes sense. We stimulate the body to rejuvenate itself, to regrow the tissue. Fibroblasts are cells that grow collagen, spit out the collagen. They're attracted to the area where we inject. And these treatments have growth factors in them and all kinds of good things that help tissue to regrow. So that's the answer to that. It's not that it didn't work for this person. It did work. It's just they didn't get the pain relief they wanted with one treatment. And that's common, just so you know that before you come in and think it's going to be a magical cure with the magic wand. It doesn't work like that. I'll give out the phone number again, 866-870-5752. Give us a call. Love to talk to you. And you can also get a hold of us at the office to get more information. We send out a free copy of the book if you call us at the studio or at the office. Office number 800-300-9300. You can also email me from every page of my website, which is www.jointrehab.com. That's jointrehab.com. And it's got hundreds of pages of the science of how regenerative medicine works, and it's got tons of videos of me doing these injections so you can actually see what I do before you decide if you wanted to do it. So it's a great website. That's www.jointrehab.com, and like I said, you can email me from every page on that website. Another question, Nita?
Let's do it.
Let's do it. Okay. My wife suffers from chronic low back pain. Let's see what they have to say. Dr. Darrow, my wife suffers from chronic low back pain. By the way, chronic means more than like 3 months. Acute is newer pain, more recent pain. A lot of people think when they say, I have acute pain for 20 years, that just means they're saying it's terrible pain, but acute is really a chronology. It means newer pain, whereas chronic is older pain. The surgeon suggested a laminectomy. That means where they take off a piece of the vertebrae in the back where the nerve exits to give that nerve some relief so it can heal, which they said would help her upper thigh pain, but not so much for her low back pain. She doesn't have much upper thigh pain. We declined the operation. Smart thinking there. Smart thinking, because the people that get these back surgeries for back pain or neck pain, it doesn't usually work. That surgery usually fails. If it's a radiculopathy down the arm or leg, then sometimes, and I say sometimes, the surgery is a great option. But rarely, because I have a friend whose name is Randy Weinzoff. He's a chiropractor. He's in Santa Monica. You can look him up. All the radiculopathies that come into my office that I can't help, I send to him. And I think he's gotten rid of every one of them by just realigning the spine. So the pressure of the vertebrae, where the foramen is the opening where the nerve comes out, is released. So anyway, this person says, we decline the operation. I treat the pain with THC cream, which seems to help get rid of the pain during the day. Oh, she uses it. I'm sorry, that's the wife. She is 78 years old. Is there anything you can do for her? Thank you. Hopefully, yeah. If she's just having back pain or if someone has neck pain, that's something that we treat every day with very good success. I'm not sure the THC cream is a good thing because it can make people a little disoriented. And if you're 78 years old, oftentimes you're not able to keep your balance as well anyway, so using a drug is not a good thing. And there's studies that show that the older you are, the more times you will fall by taking drugs to get rid of pain, because they sort of disorient people. There's better things to do, which is to fix the problem. I'd love to examine this person's wife, and I'm guessing, just based on what this patient has written in, that we can help get rid of the pain. So simple injections using platelets and or stem cells into the low back, and this works all over the spine. I have a lot of people with scoliosis. It doesn't get rid of the curve, but it gets rid of the pain. And a lot of people with herniated discs, well, they can have a herniated disc and it may not be the problem. It may be that there's a sprain of the ligaments. And I can't get rid of herniated discs. That's a surgical issue. But it's not necessarily a herniated disc that's causing back or neck pain. That's more for the radiculopathy or the nerve pain down the arms or legs. Should I take another? I'll give out the phone number.
Okay.
Give me a call. Come on. Make it interesting. Call me now. Right at the studio. 866-870-5752. Or you can call the office. 800-300-9300. Or you can email me through the website, www.jointrehab.com. All right, so this one is called radio frequency ablation. I hate that.
What is that?
I know.
Wow.
Well, use radio frequency to ablate or burn a nerve. It's not the best way to heal something. It's a Band-Aid in a sense. I know it's done very frequently, and I have a lot of patients that do it. And then they come in to see me and go, it didn't work, or it worked for a month, and then the pain came back. Does the doctor do radio frequency ablation? Nope, I don't. I don't believe in it. It's just my preference. I know tons of doctors do it. I don't like the idea of burning nerves. I don't like the idea of using, when someone has pain, using Botox, because that paralyzes the muscle. I believe in healing areas, okay, not putting Band-Aids on them. And the way that I heal is by using a natural method called regenerative medicine, taking cells from your body and putting them where the pain is, using platelet-rich plasma or stem cells. And it's a simple injection. It's so easy. I use an ultrasound to guide the needle. In most cases, sometimes we don't need it, depending where we're injecting. And there's a little bit of inflammation that takes place after the injection, usually overnight or next day. And then hopefully the pain starts going away over the next week or so. Simple. Walk in, get injected, and walk out. Here's another one. Tendinitis in both elbows. I've had that, by the way. So this person says, I have tendinitis in both elbows and my wrist. It is a result of work-related injuries decades ago. I would like to know more about regenerative therapy and long-term effects and what it is like to have it done. Simple. Like I just said, you walk in, get some blood drawn, and walk out after injections. With the stem cells, it's a little bit more complex, but not very much. I had lateral epicondylitis, that's tennis elbow, in both of my elbows at different points in my life. One time was from tennis, overusing it. It's called the extensor tendon. Golfer's elbow I've never had, but a lot of my patients do. That's the medial epicondyle, and that's the flexor tendons. I've healed both of my elbows by using regenerative medicine, and I haven't had any reoccurrence of that in, I'm guessing, the last 20 years. So it works great. Prior to that, when I was a lawyer and I didn't know about regenerative medicine, I went to an orthopedic surgeon for a tennis elbow, and he gave me a couple of steroid shots. And it felt great. I went out and played tennis later, and it came back worse. So I'm not a believer in using steroid or cortisone and things like that. And it can really damage the tendons and thin them out. So steroids are great for certain things. You know, if you have asthma or something like that, it'll help you breathe again. But using it in the musculoskeletal system, I don't think is a good thing. A lot of doctors give out prednisone, which is a strong anti-inflammatory steroid, to quell the pain somewhere in the body. I don't like to do that. I think I've done it twice in my career of over 25 years doing this. I don't like to do it. It can actually kill the hip joints. There's a little artery that goes to the hip, and for some reason taking the steroid pack, it's called a Medrol dose pack, can, I'm going to say frequently. It's not that frequent, but it's happened enough where I've seen a lot of people that end up with dead hips. The bone actually dies from taking a Medrol dose pack. So I don't like that. I like to get in there, fix the problem naturally, and regenerative medicine has been working for me for over 25 years and my patients, and I love doing it. So let's see what else. Let me give out the phone number. Today is a great day, a great show, but we need your calls. Don't be shy. It's 866-870-5752, 866-870-5752. And if you're too shy to call, I hope you're not, you can use a fake name. Just call the office, 800-300-9300. And if you don't like to use the phone, just dial in www.jointrehab.com. You can email me from every page on my website and watch videos of me doing regenerative medicine. So, Nita, I think it's time for you know what.
Oh, I'm so ready for that today.
You have your thinking cap on?
I do.
All right. Should I give you an easy one first?
Sure.
All right. What has 4 wheels and flies?
A flying car.
A garbage truck.
Oh, that kind of fly.
Yeah.
Okay.
Okay, you ready for an easy one?
Maybe you should just give me a hard one.
All right.
Okay.
What's the difference between a poorly dressed man on a tricycle and a well-dressed man on a bicycle? A tire.
Whoa, that's a good one.
That is kind of good. Makes you think, doesn't it?
Yeah, it does. I was still thinking when you answered, just so you know. I was still thinking.
Now, even you should get this one. You ready?
Uh-oh. Oh, wait. We have to talk to Don in Culver City. Yay! Oh, thank you so much.
Don, you couldn't stand the jokes. Thanks for calling in. It's Dr. Marc Darrow. You have issues with your knees and your left arm. What's the first issue that's the worst?
Don, can you talk a little louder?
Yeah, I was having a hard time hearing Dr. Darrow.
Okay, I'm with you, buddy.
Okay.
What's worse, your knees or your arm?
I'm sorry. I was diagnosed with ulnar neuritis in my left arm and hand. I thought I had Dupuytren's contracture.
Okay.
I went to a hand specialist and they said no, it was not. And I had the test where they put the electrodes in.
Yep.
And the left arm was pretty bad compared to the right arm.
Okay.
Anyway, being a guitar player for almost 60 years, I got to a point where I couldn't form certain chords because I couldn't get the left finger, the little finger. That's the issue. And I was wondering, can you do anything with an ulnar neuritis?
It's possible. We can do sometimes what's called a hydrodissection at the ulnar groove in the elbow, if that's where the impingement is. When you had your nerve conduction,
I actually had an injury. It just sort of just developed.
Well, being a human being is an injury. It's called wear and tear.
That's true. Yeah, thanks for that. Well, I always had a problem with the grip strength in my left hand, but when I started getting into rock climbing, 25 years ago, my grip strength got stronger. Anyway, that's the one issue. The other issue is I was diagnosed with I had the X-rays taken, bone on bone in both knees.
Okay.
Now, I don't have pain, just general pain when I'm standing or sitting or even just generally walking, but going downstairs is a little bit of an issue.
Okay. So
and,
here's something.
I used to be a workout fanatic. I mean, literally, I was working out 4 or 5 days a week and going rock climbing 3 days a week. And,
well, there you go. That's good. It's good. It's good.
I'm not. Believe me, if you can see the pictures of the 10, 12 years ago, oh man, all 5% body fat, all muscle, and only 6'2" and about 180 pounds.
Perfect. You know, every single patient says one thing: I used to.
Yeah. Well, the arthritis in my knees started bothering me because I couldn't do certain high steps and put all that weight on my legs, and because climbing is almost it's a lot of leg work. People don't realize that.
So, do you mind if I talk a little bit, Don?
Yeah.
Okay, because I think I got your story down. The ulnar neuritis is sometimes something we can help if we find that the impingement is at the elbow. For instance, there's a thing called the ulnar groove that
right,
and we can sometimes put some saline in there and push that nerve away from the bone and heal it up.
That caused the little finger to straighten out because the little finger is curved. I can't straighten it out.
It's possible, but probably not. That's probably a trigger finger or arthritis. I'd have to examine you.
Yeah, I mean, it's really frustrating because I play flat pick bluegrass guitar and stuff, and it just I had to start playing slide guitar because I couldn't make certain chords. So
I get it.
Very frustrating because I was a very good flat pick guitar player. So
yeah, okay. May I talk?
Yep.
Okay, thank you. So I'd have to look at your finger, look at your elbow, and see if we can help. The knees, you do not have bone on bone, just because you're moving around, I know that. And I think we can help you. Give us a call at the office, 800-300-9300. And it's great talking to you, Don, and I appreciate you. And God bless you, Nita Valens, and the rest of the crew, and our callers and listeners. And we'll talk to you soon.
We'll see you next time. Thanks for listening.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.